Hello Medicos, welcome to the MBBS Materials. So today I will discuss on the topic Medicine Practical. This is a series for final year MBBS student, and the topics I will be covering here are a detailed topics on medicine. After that I will cover all the topics related to other subject too. So the topics I will start from will be the approach to a case, and that will be by taking the history. So the format for a history for any case is the first topic in this series, and after that I will upload the other topics like general survey, all the topics separately, and then I will go for systemic case based discussions, and finally I will upload the clinical videos and examination videos of medicine for final year MBBS student. So today's topic is the medicine practical series for final year, and the first video of this series is workup for the medicine by taking history. So let's start. So an ideal history proforma, this should be under some headings. The first heading should be patient particulars, and under patient particulars we'll write the patient name, age, gender, his socioeconomic status, that is occupation, that is his address, okay, and then his or her date of admission, date of examination, bed number, all of these should be mentioned here. And in some cases you can also take blood group, but this is very important for gynecology practical cases. Usually the medicine cases, the blood group is not that much important, but you can mention it and it will be a very good thing. Okay. Then the chief complaint. Chief complaint. So chief complaint, nowadays some pediatric clinician they talk it as presenting complaint. You can write it at chief complaints, or if your teacher says, you can write it as presenting complaints. Okay. The two thing is mentioning the same thing, and write in the chronological order 2 to 3 points, not much. Chronological order means first the suppose the first symptom arise 30 days ago, second symptom arise 20 days ago, and the third symptom it arises 7 days ago. So this is the chronological order. Okay. Then there will be history of presenting illness, and the history of the presenting illness means you will elaborate here the chief complaints you have written here. Suppose some patient has angina like chest pain, so its position or location, its onset is acute or sudden or insidious onset, its type or character, its aggravating and the relieving factor. So these all kinds of things should be mentioned here. Here you will write the elaborate by elaborating the chief complaints and some important positive things and important. So positive history is important and negative history to rule out the other causes. Okay, this should be written. Finally, their past illness. Here you can you should write it any kind of surgical history, any kind of treatment history, any kind of hospitalization, any kind of drug history. Okay, this should be tubercular history, treatment history. This should be mentioned in the past illness part. Okay. Then there is family history, same kind of illness, any kind of, suppose a cerebrovascular accident patient came. So you will ask if the same episode happened, any kind of his family members and they died. Suppose a ascitic patient came with jaundice. Okay, so if the and he is a young patient, so you should ask if this kind of same scenario happened in his family and they died, because this can point out to the occurrence of familial any kind of disease. Suppose Wilson disease, this can be happened. Okay. Then there will be personal history like bladder, bowel, appetite, sleep, okay, any kind of addiction. This should be added in the personal history. Then if this patient is a woman, you can write a small and relevant obstetric and the menstrual history, okay. This can be written. Then the examination part. Here you will do general physical examination or general survey. Then you will do systemic examination. One thing you should keep your mind that in the examination you give suppose a CVS case. You should also look any other problem in respiratory, CNS, okay, GI if there is. Otherwise you can write is other system is otherwise normal, but you should at least look. It will not take that much of time, but you can be assured that there is nothing there. Then there is summary of the case. You will write here the same things and in a summarized manner. Okay. Here some important positive and negative history should be written must. And the final is the provisional diagnosis. In the provisional diagnosis, what will you write? You will write provisional diagnosis, some etiology, and some DDs. Why you are not telling them that this is a case of this? I am giving here as an example. Suppose you have a pleural effusion, which is suppose right-sided, and it is due to a tubercular origin. So you will write this is a case of right-sided pleural effusion due to tubercular origin, and points in favor are suppose he or she has some weight loss history, night sweat history, contact with some tuberculosis patient. Okay, so you have to mention this and some negative history in the DD. In the DD, sorry, negative history, not negative history. In the DD, you will have why you have rolled out. Suppose you have rolled out a CCF. This is not due to congestive cardiac failure or heart failure. So you will tell that he or she does not have any kind of pedal edema. Okay, any kind of the other sign of heart failure. Or you will see that this patient is not ascitic. So the chance of hepatic hydrothorax is less. Okay. This way you can frame your history pro forma and write the proper history. A crisp and good history is important to get good marks in the practical examination. This is the doorway. And after that, you will encounter your teacher with related questions, and the process will be go on. So if you are a very good student, you have no problem. But for an average student, you must write your history pro forma crystal clear so that at least teacher can understand that you have no, at least professor can be assured that you have read something. And I am ending the video here. The last thing I want to tell you that I will continue the series, and when the series is over, then I will also try to discuss some summary of the cases, important cases for the final year students. And from that, you can have an idea that why you should not write history from here and there. You should be this crystal clear. Okay. So subscribe my channel and see you later.